Hey guys, I'm here for Drug Quiz 16. Congrats on being done with your midterms. You guys are doing well. Hope the lab went well. Sorry to miss you, just a work conflict. But let's get started. We've got some tricky ones this week and some easy ones as well. Methotrexate or Otrexup is a DMARD or a disease-modifying antirheumatic drug. Complicated drugs used to treat autoimmune disorders. Basically, they reduce your body's ability to attack itself, but unfortunately also reduces your ability to attack infections and such. So people taking these medications can often be more susceptible to illness. Kind of a tough time to be on these kind of medications. The next one is etanercept or Enbrel, also a DMARD, and it's an injectable and very expensive. Then we have good old aspirin, Bayer, Ecotrin, or Bufferin. You've all seen it and heard of it. It's an analgesic for pain and an antipyretic for fever. Then we have acetaminophen, Tylenol, as you know, comes in a lot of different strengths over the counter. 325 milligrams, 500 milligrams, and 650 milligrams, and often is combined with other things. Most commonly diphenhydramine for Tylenol PM to help with sleep and pain. But it is also an analgesic and antipyretic. Then we have butalbital with caffeine and APAP, which is, as you know, acetaminophen. Brand name is Fioricet. It's a long time around old medication for migraines. It combines an analgesic, an antipyretic, and a barbiturate. And caffeine actually is a vasodilator, so it opens up blood vessels and can actually be helpful with migraines. Ironically, too much caffeine can actually cause migraines as well, so it's a little tricky. Then we have diphenhydramine, which I just mentioned, plus acetaminophen. Nighttime product, the brand name would be Tylenol PM, analgesic, antipyretic, and antihistamine. Not really using the antihistamine for the allergies so much as its drowsiness side effect. So really the only over-the-counter class of medication used to help with sleep, aside from like melatonin and some other natural products. Then we have fingolimod or fingolimod Gilenya, which is immunomodulator. I have never seen this. I suspect it's probably used in a hospital or a very specialty setting. We do see occasionally cyclosporin, brand names Sandimmune or Neoral, which are actually two slightly different versions of cyclosporin and cannot be interchanged. Immunosuppressant. Then we have dicyclomine or Bentyl, which is antispasmodic, used for people most commonly having some sort of digestive cramping and discomfort. And last for the week is chlorhexidine. Betasept and Chloroprep might be the more topical version. The one we see most commonly in a retail pharmacy setting is Paradex. It's an antiseptic for the mouth. It's not to be swallowed. It's for people to use before and or after dental procedures to keep bacteria out of there, to reduce and or prevent infections. So that's it for the week. As usual, send questions if you have them. Keep checking your grades to make sure you're all caught up, and if you have any specific questions, need practice calculations, so forth, just let us know, and I will see you guys at the next lab. All right, bye.